The viability standard being chosen by the Democrats also means that their bill doesn't actually codify Roe versus Wade. It codifies Casey. And there is a significant difference between those two, with Casey being the worst of the two options because it's not as clear as the 3-trimester structure from Roe versus Wade. And that's just a significant difference from what's been said by the Democrats about their bill. Here's 4 Democratic senators, Tammy Baldwin of Wisconsin, Chris Murphy of Connecticut, Ed Markey of Massachusetts, and Tammy Duckworth of Illinois during the Senate debate on this bill on May 10th.
The Women's Health Protection Act of 2022, which I lead with Senator Blumenthal, would indeed codify Roe versus Wade.
The Women's Health Protection Act, it does codify Roe versus Wade.
The Women's Health Protection Act will do all of that by codifying Roe to affirm it as the law of the land.
The Women's Health Protection Act, which would codify Roe v. Wade once and for all.
It makes me crazy that these people care so little about accuracy in their explanations, especially when the difference between what they are saying and reality are so significant. Because people knowledgeable about those two cases would reasonably assume that the 3-trimester framework would be in the bill if they hear from members of Congress that this codifies Roe versus Wade. And yet that assumption, that reasonable assumption, would be wrong. It's a big difference. And this is why I don't think that the Democrats in Congress took all that much time to examine their own bill. And them not knowing the huge difference between codifying Roe and codifying Casey, which is what they actually did, it's just a huge red flag for me, signaling that this was a message bill, not a genuine attempt at lawmaking.